Hi, my name is Farhad Hafezi from the ELSA Institute in Switzerland. I'm a corneal refractive surgeon with a special interest in therapeutic aspects. I've been with Schwind now for 14 years, and I remember many user meetings. The user meeting in general is a fantastic opportunity to meet friends and colleagues who are at the top notch of their field using the AMARIS, so we can exchange on the latest developments in the techniques, in the ablation profiles, and in approaches, especially in complex cases. This year's user meeting is special for two reasons. On the one hand, I believe it is the largest gathering we have had so far. And on the other hand, it's just refreshing to see how much innovation and drive still is in the field after 40 years after the initial PRK had been performed by Theo Seiler. So instead of staying stagnant, the field is moving forward at rapid pace. The AMARIS laser is at the forefront of surface ablation. And when speaking about cross-linking, we usually cross-link people who do not come for cosmetic reasons. They come to the doctor to seek therapeutic help. Cross-linking stabilizes the cornea, and the AMARIS is, in my eyes, the most advanced excimer laser to improve the visual quality of the patient. And there are multiple ways we can combine cross-linking and excimer laser ablation. May it be to improve visual quality, may it be in very new aspects like customized cross-linking, PACE that we have just presented today at the Schwind user meeting. The whole field started 24 years ago with Epi-off cross-linking, and Epi-on, that was introduced initially in 2009, has had a rather bad reputation, if you want so, for many years because it had been introduced into the market prematurely. So the technique was not really ready, but rather pushed by industry towards the end user. Now, 15 years after the initial introduction, we have an Epi-on that works very well. The Epi-on we developed at the ELSA Institute, and that is now part of the Imagine Epi-on system, does not need additional iontophoresis, does not need additional oxygen as the others, so it can be used very easily and comfortably, even at the slit lamp or under the AMARIS laser. And this Epi-on is just as strong as the standard accelerated Epi-off. So it is a paradigm change we are expecting to see in the next few months once the solution that is necessary for this type of Epi-on under the AMARIS has been CE marked. PACE is a second generation customized cross-linking that we have developed at the ELSA Institute 3 years ago. What PACE does is it delivers more energy over the tip of the cone by delivering 3 different gradients. We perform an Epi-on, the Epi-on I just talked about, which is very strong over the entire cornea, but then we deliver specifically more energy over the tip of the cone. We also remove the epithelium over the tip of the cone with the AMARIS laser without removing any stroma, and we have a riboflavin saturation gradient. Taking all these technical aspects together mean that the patient has a dramatically different cone a few minutes after the treatment. And we see patients improving their astigmatism, becoming much more regular, and improving the vision by 3 lines, 4 lines, 5 lines. So it's a paradigm change where we use cross-linking not to stabilize the disease, we use cross-linking to stabilize and improve on vision. And the nicest of it all is after the combination, and it needs a combination of the AMARIS laser, the CI device, and the MS-39 from CSO Italia. Once we have delivered PACE, nothing keeps us from performing another wavefront-guided trans-PRK 6 or 12 months later to even further improve. So it's a very nice addition to the Schwind platform.